Assalamu alaikum, this is Shamama Zara, and today I'm starting a new topic that is basically it's a constrictive pericarditis, but my main topic of discussion today will be septal bounce sign. We will discuss in this video what is septal bounce sign, what is the mechanism of septal bounce sign, how it is produced in relation to the to different factors, and at the end in which diseases along with constrictive pericarditis we can see the septal bounce sign. So starting our discussion, first of all, the first topic, first heading that we will discuss under it is that what is the definition of the septal bounce sign. So we'll start with, first of all, how we will define septal bounce sign. Basically, septal bounce sign is I'll explain you the definition, but first of all, just listen to the definition. I hope it will help. What is septal bounce sign? It is the paradoxical motion of the interventricular septum to either side of the ventricle. Why? Due to change in pressure between the two ventricles plus the restraint or the resistance shown by the thickened pericardium. This is basically the septal bounce sign. Fine. Now we will discuss that. Okay, I know you have heard this definition up. Nothing has been cleared in your mind, just English words. But now we'll discuss in detail what are the mechanisms that are involved in it and how. Then at the end of this video, you will exactly become master on the septal bounce sign and you can easily identify this sign. Fine. So, starting our discussion, to understand the septal bounce sign, you should know the concept very well of the ventricular interdependence. Now, second top point which we will discuss is what is ventricular interdependence. Now, this name indicates that there is some dependency, like I'll explain. Ventricles are involved, fine. Inter, between the two ventricles, dependence. So this name indicates that maybe it's a phenomena in which the two ventricles, right ventricle and the left ventricle, they are interconnected with each other, they are dependent on each other. This is basically ventricular interdependence. A layman definition or layman explanation which comes in your mind after reading this word. Now, what exactly interdependence is, I'll explain you now. That the increase of volume in one ventricle cause decrease of volume in the other ventricle. Or you can say the same thing is that the increase in filling of one ventricle is related to decrease in filling of the other ventricle. Now, to easily understand this concept, you can imagine these are interdependence. Whenever they come, inter means that the two things are competing with each other. Fine. So when they are competing with each other, one goes up, one goes down, one becomes high, one becomes low. So from this concept you can easily remember that increase in volume of one ventricle, increase filling of one ventricle leads to decrease filling of the other ventricle. This is basically ventricular interdependence. Fine. Now, to understand ventricular interdependence, how it occurs, when it occurs, another concept that should be clear in your mind is that normally under normal conditions what happens. Now why I'm discussing normal in almost all my videos is it's very important that when you know a normal function or a normal mechanism, you can easily identify the abnormalities, or you can easily understand, more precisely word used, the abnormalities. Now considering about the normal conditions, imagine this is our heart. I'm making just the ventricular part of the heart. This is our septum, interventricular septum here. Suppose these are the two layers of pericardium that surrounds our heart. Now imagine this is the right ventricle, suppose left ventricle, interventricular septum. This is the pericardium, and this space between the two is the pericardial cavity. I write it as PC. Fine. Now under normal conditions what happen is that whenever the diastole occurs, blood comes from right atrium to the right ventricle, left atrium to the left ventricle, filling of these ventricles occur. Now under normal conditions this pericardium is distensible, means it is slightly distensible, plus the space is available where the ventricles can expand in response to increased volume coming in them. Fine. Just imagine as a balloon, it expands as you fill in air, more air within it, it expands and expands to accommodate the extra amount of air that we are continuously inflating in the balloon. Fine. Now this occurs in a normal condition. Easily blood comes here, ventricle distend up to this. Here easily it can accommodate the increased amount of volume, and hence the cardiac cycle goes on. But what if this wall becomes thick? I'll make this again. This is a normal one. Now I'm talking about the the constrictive pericarditis case. Constrictive pericarditis. We'll consider the same as the same labelings we discussed above. Suppose this is again the ventricles. This is the interventricular septum. These are the two layers of pericardium. Fine. Now what happens in this disease is that what is constrictive pericarditis? First of all, you should know what is constrictive pericarditis. It is a disorder in which there is fibrous scarring of the pericardium, which leads to thickening of the pericardium. Of course, whenever a scar mechanism or scar formation occurs, it leads to thickening of the wall and thickening of the pericardium. And imagine if this is the wall and becomes more and more thicken, then it will obliterate. It will start obliterating the pericardial cavity. Now this is what happens in constrictive pericarditis. Now apply this concept on this diagram. This pericardium layers, it has undergone fibrous scarring and has become thickened. Suppose this is the thickening of the pericardium. Now this thickening mechanism, what it has done, it has reduced the size of the pericardial cavity. Fine. Now when blood comes in, make it with red. Now in this condition, when blood comes in both the ventricles, what will happen is that ventricles can expand to some extent. As we know that the diastole phase, it's divided into three phases. So its first phase is the early rapid filling. Fine. So what happens in this disease, constrictive pericarditis, is that the pericardial cavity is now decreased in size, less than normal. So when the blood comes in, ventricles expand at a point, and the diastole abruptly stops. It's like, suppose this is the pericardium wall, imagine, and this is my ventricle. This was the pericardial cavity, which is now reduced in size. I have inflated blood in the ventricles. Now this ventricle wall is expanding, going close to the limit the thickened pericardium has set. Fine. As early diastole continues, but As it reaches the limit, it claps here. This is called the pericardial knock, which is heard on auscultation. And after this point, there would be no expansion of the ventricles. Now, if the blood is coming on, then it will cause this septum to deviate on either the side from high pressure area to low pressure area. I'll explain more easily that if this is the pericardium, and this is my ventricle wall, it can't expand more after the limit is set by the thickened pericardium. Imagine it as a thick concrete wall. How much pressure I will apply, it will not move from its position. Now, this pericardium, to accumulate the extra amount of blood coming into it, will now lead to movement of the septum. Now, at this state, what will happen? Ventricular interdependence will develop. What is that? That the paradoxical motion of the interventricular septum occurs from high pressure area to the low pressure area. Fine. So this was the whole basic theme of our today's discussion, that what will happen and how will happen. But to understand this concept, you should also know another concept. I hope you will already know it, but it's just a quick revision if some people don't know. That they are now this septal movement on either side, it is associated with or dependent on two things. Number one, it depends on it is associated with breathing movements like inspiration and expiration. Different septal movements will occur during inspiration and during expiration. Plus, it depends on another point, that is interventricular difference of pressure, means pressure difference between the two ventricles. Now, here we have to understand a very, very, very important concept which will apply in almost many of the diseases of the heart. So you should know this concept. Two phases. First of all, talk about the breathing process. We know breathing has two phases, but first of all, we're talking about inspiration, and then we'll talk about expiration, as it would be entire opposite to it. Now, what happens during inspiration? When we inspire, so I write the points here. When we inspire, what happens is that we take in air into our through our airways to the lungs, so we have to expand our thoracic cavity. What happens is that negative intrathoracic pressure is created. Why? Because of expansion of the thoracic cavity. Now, thoracic cavity has increased in size. First point, lungs expand. Now, as we know that lungs, they overlap our atrias. So when lungs expand, its pressure that it was in normal conditions applying on the right atrium is now reduced, because lungs are now move away because of expansion. So the right atrial pressure is reduced. Now, suppose this is the right atrium, its pressure is reduced. It has two connections, two veins draining in it, superior vena cava and the inferior vena cava. Now, when the pressure within the atria has reduced, then what happens is there is rapid emptying of the blood from the superior vena cava. Superior vena cava rapidly empties its blood and more amount of blood into the right atrium. At the same time, during inspiration, what happens that diaphragm, it moves down to increase the space of the thoracic cavity. When it moves down, it applies pressure on this inferior vena cava. Now, when this diaphragm, it applies pressure on this inferior vena cava, it also squeezes it out. So it also, inferior vena cava, rapidly empties its blood into the right atrium. Now what happens is that in the right atrium, because of these two mechanisms, increased amount of blood has reached within the right atrium. Now, of course, this increased amount will now empty into the right ventricle, and now ventricle has increased amount of blood. Fine. So when increased blood is pouring into the ventricle, it will of course expand then expand up to a limit that is offered by this thickened pericardium, claps with the pericardium, pericardial knock is heard. Septum movements I'll explain in a while. Inspiration concept is clear. Now, another factor which is involved, just a second, that is that right ventricle filling, it occurs earlier, slightly earlier than the left ventricular filling. Now, apply these two concepts. One concept is that during inspiration, increased amount of blood comes into the right atrium and hence the right ventricle, plus right ventricle filling occurs earlier than the left ventricle. Again, I'll make that heart, and now you have to apply this concept with me. I hope it will clear your whole confusion. Sorry, if this is the whole thickening due to constrictive pericarditis that has occurred, this is the interventricular septum between them. Now, with me, this is right ventricle, this is left ventricle, pericardial cavity and all. Now, increased amount of blood is coming in the right ventricle. First, increased amount of blood, plus it is occurring early filling as compared to the left ventricle. So now you will tell me that what will happen, increased amount of blood will be in the right ventricle as compared to the left ventricle, means there would be increased pressure in the right ventricle greater than, of course, the pressure within the left ventricle. Now this ventricle wall will expand at a limit, will dilate until the limit that is set by this thickened pericardium. But since we have very increased amount of blood, so the extra amount of blood that comes will now start to pool up here. When there is increased amount of blood here, less amount of blood here, this increased blood will apply pressure on this septum, and septum interdependence, ventricular interdependence occur. This septum will now, what it do is, it will deviate, or more precisely I will say that it will bounce towards the left ventricle. I'll explain you how it bounces. Suppose this bulge is formed into the left ventricle. This is a septum which has now moved to the left ventricle. Now, when a patient inspires, repeat with me. Patient is inspiring, increased amount of blood coming, at a limit ventricle can expand. After it, increased amount of blood is accommodated by moving the septum toward this side, increasing the space, creating room for the extra amount of blood to accumulate within it. Fine. When this occurs, it causes septum to move to the left side, which is called the septal bounce sign. What it is, I'll write here, it is the septal bounce sign, which is our main discussion today. And during inspiration, the septum, it moves from right side towards the left side. First point. Clear? I hope now it will be clear in your mind. Now, what will happen? Now you will exactly know by yourself. It's not required that I explain, but still I explain you that expiration. Now what will happen during expiration? During expiration, the same thing will occur in the opposite manner. Now during expiration, there would be increased amount of blood. How increased amount of blood? I'll explain. What happens during increased expiration? Recall with me. It's your basic concept of physiology. I hope you all will know. But if you don't know, it's very easy. We'll recall it together. What happened during expiration? Our lungs, they have to contract. They have to contract to squeeze the blood, to squeeze the air out of our body through the airways. Now, when the lungs contract, within it, pulmonary veins are present. They will also contract. In short, they will constrict or contract, whatever you can say. Same point. When they constrict, now imagine a vessel. Whenever a vessel constrict or it contracts, what happens is pressure within the vessel is increased. Now, due to this increased pressure, these pulmonary veins will squeeze their blood rapidly and more amount into the, sorry, these are pulmonary arteries. Yeah, they will squeeze the blood into the left atrium. Sorry, I'm getting confused. These are veins. So sorry for this inconvenience. Pulmonary veins, they constrict, squeeze the blood into the left atrium. Now this is increased amount of blood. This increased amount of blood, of course, from left atrium move to the left ventricle, and now in expiration there is increased amount of blood in the left ventricle. Blood is increased in the left ventricle. What does this increased blood show? That now in this case, very important, the left ventricle pressure is more than the right ventricle pressure. Now this increase of pressure on the left side will cause, apply on this diagram, pressure is increased here, less here. This septum will move towards the right side and the bounce occurs toward the right side during expiration. This is the septal bounce sign. I'll write the conclusion here that septal bounce sign during expiration or expiration as you pronounce it, septum will move from now left towards the right side. This is basically the whole concept of the septal bounce sign, how it occurs, the whole mechanism. Now, last topic of our discussion which we are going to discuss now is what are the differentials. Like if you have, before it we'll discuss that how we will see this septal bounce. So this septal bounce is seen on two modalities, 2D echocardiography. It shows the septal bounce sign, plus it can also be seen on MRI. But more importantly, we use this 2D echocardiography. Now, last point of our discussion today is that what are the differential diagnosis when we see septal bounce sign in a patient. Now, what are the differential diagnosis? First of all, I'll write the disease's name, then I'll tell you an easy way to remember all of them. First of all, it is the classical presentation of constrictive pericarditis, which whole topic we discussed today. First is constrictive pericarditis. Second, it can also occur in cardiac tamponade. Why? Because in the cardiac tamponade there is also decrease or resistance to the diastole phase of the ventricles. Thirdly, it can also occur in left bundle branch block, pulmonary hypertension, and right ventricular pacing. Now, just easy way, a basic theme in your mind to remember is that whenever ventricles filling is affected, at that state, or whenever the ventricles ejection is affected, at that state. In both the cases, blood will be increased within the ventricle and it can cause septal bounce sign. Fine. So, applying this concept in constrictive pericarditis, ventricles have to accommodate increased amount of blood, but after a limit, due to thickness of the pericardium, ventricle can't expand, so the septum deviates to either the side depending on from high pressure to the low pressure side. In cardiac tamponade, what happens is that in the whole pericardial cavity, fluid is accumulated, which can be blood, which can be any fluid, that fluid, it offers resistance to expansion of the ventricles. It can also cause septal bound sign, deviation of the septum, paradoxical motion of the septum to the either side during pulmonary hypertension. Why? Because now talking about right ventricle has to empty its blood, where right ventricle has to empty its blood into the pulmonary arteries, right? So it has to empty its blood into the pulmonary arteries, pulmonary vessels now. So whenever there is hypertension, like I'll just show you diagrammatically, it will be more clear. Like again, in considering this whole ventricle, we are more talking about the right ventricle. Right ventricle has to empty into the pulmonary arteries. Now when it empty into the pulmonary artery, if in normal conditions blood will empty easily, but if the resistance within the pulmonary artery is high, more precisely if there is increased pressure or pulmonary hypertension, then in that case ventricle has to apply a lot of force to pump this blood into the pulmonary arteries. In that case, when the ventricles is unable to apply that much of force, blood will start to pool up in the right ventricle, which can lead to left side septal bound sign. That is the reason of pulmonary hypertension. So ventricles are unable to eject properly, applied concept here, and in right ventricular pacing and in the left bundle block. So this was my whole discussion on the septal bound sign today. It has become a bit long video, but it will help you a lot in clearing your many of the basic concepts and in linking the points of the chain when you are studying different topics of the cardiology. Now, just a brief overview or a quick summary of the whole discussion. What is septal bound sign? It is paradoxical motion of the interventricular septum to the either side from high pressure area to the low pressure area. Ventricular interdependence, because of ventricular interdependence it mostly occurs in constrictive pericarditis when there is thickening of the pericardial wall that lead to early distension is possible, but when the limit is reached set by this thickened pericardium, then filling will not occur. Fine. Septal movement occurs, it depends on the breathing and on the pressure difference between the two ventricles. Then there is a difference that during inspiration, because of the mechanisms which lead to increase venous return to the right atrium and hence the right ventricle, so during inspiration what happens is that the septum, it deviates from right side to the left side, septal bound sign is seen, and during expiration entire opposite to it, it deviates from the left towards the right side. How we will see this? It is seen in 2D echocardiography or MRI. Differential diagnosis of this sign are classically is constrictive pericarditis or cardiac tamponade, left bundle branch block, pulmonary hypertension or right ventricular pacing. Thank you so much for having patience of listening the whole long video. I hope it helped you out. I hope it cleared your concepts. Thanks a lot for your support. At the end, it's a request to please like, share and subscribe my channel, and do press the bell icon so the nearby or the upcoming videos which are coming every day, you'll get notification of them and you don't miss any video. Thank you so much. Allah Hafiz. See you in the next video.